So this is an example of experience and how I related it in my personal statement. So I'm just going to read it out to you guys, and I want this to be what's the word, interactive. In the chat I'm going to read it out, and in the chat I want you guys to say what you think of it, what you would do to change it, and any thoughts that you have. Golden minute. Okay, I'll explain that to you. So I'm going to read it out. So when observing a GP in his consultations, I appreciated his use of giving every patient a minute at the beginning where they could talk freely. This allowed the patients to feel comfortable enough to express their concerns, thus creating an area of open communication with the doctor and patients who are able to work together, allowing for accurate diagnosis and effective treatment. And it's what Bilal said, it's the golden minute, right? A lot of GPs and a lot of doctors will tell you this if you shadow them. So this golden minute, what I did was I could have just said, when observing a GP in his consultations, I appreciate his use of giving everything a minute at the beginning where they could talk freely. That's my experience. Okay, cool. Let's move on to the next experience. But there's no substance to that, right? There's no actual application of what that taught you. End of the day, the experiences that you've done isn't for you to just, it's not a tick box, it's not a checklist where you're doing it for the sake of ticking it off. You're doing it for the sake of increasing your understanding or widening your understanding of the medical field, what it means to be a doctor and being a doctor in the day, right? What's the word? Sorry, I misworded that. Being a day in the life of a doctor, basically, right? So then what I followed up with saying is, this allowed the patients, so it's like my reflection, what I saw, what I processed. This allowed the patients to feel comfortable enough to express their concerns, thus creating an area of open communication with the doctor and patients who are able to work together, allowing for an accurate diagnosis and effective treatment. Now this worked really well because in my interview, they actually brought it up in my BARTS interview in the panel. And what they appreciated was, you gave your experience, right? And then you've now said what you've learned from it. Again, I'm going to keep repeating this. It's reflection, reflection, reflection. It's what you've learned from it. And I'm going to give another example of how you can show the characteristic that you have that applies to being a student or being a professional. So this allowed patients to feel comfortable enough. Now, when we talked about a lot of these buzzwords, right? Patient-centered care, empathy, resilience, etc. You want to be chucking in these words wherever you can throughout your personal statement. So when I talked about this allowed patients to feel comfortable enough to express their concerns, okay, another thing, just a side point, anything you write in a personal statement is like a stepping stone to what you're going to mention in your interview. They go hand in hand to an extent, right? So if you're doing, there's two types of interviews that you might have heard if you came to the last seminar, which was panel interviews and MMI interviews. In a panel interview, most likely they would have had to read your personal statement and they'll bring you up in the interview and they'll ask you questions about it, and you can elaborate more on it. So when they asked me about this sentence in my personal statement, they said, elaborate what you mean by this. So I said, okay, so the GP, when he gave the patient a minute, the golden minute to talk, the patient felt a lot more comfortable with conversing with a doctor. It wasn't a formal relationship. It wasn't a patient coming in, the doctor saying, how can I help you today? Let's get this over with, prescribe your medicine, you go on your day. It wasn't like that at all. Rather, it was a conversation, it was a dialogue, and there was a rapport being built. That's another word, a rapport. Building a rapport with your patients is a very nice buzzword of phrase they love to hear. So now the patient feels like this isn't just someone professionally meeting them and diagnosing them, rather it's someone who actually cares for them, has empathy towards them. These are the buzzwords you want to be using. Empathy towards them, and they feel more comfortable. And when they're feeling more comfortable, more relaxed, they genuinely tend to speak more. And as a doctor, that's what you want. As a medical professional, you want what's in the best interest of your patient. And the best interest of your patient is the most accurate diagnosis. Now, how do you get the most accurate diagnosis? You get the full story from your patients. And this whole thing of building that rapport and building that relationship with your patient allows for the patient to give you the whole story, to bring about details and feel comfortable with saying things so that you can give the most accurate diagnosis and effective treatment for them. So do you see what I'm saying? It's not me just saying, I did this, I went to the GP, I saw him do that. Okay, then I went to the A&E and I saw another doctor do this. This is what it taught me, this is what I saw and how it's effective and why it's so important to have this as a medical doctor. So yeah, I talked to my local dentistry. Do you want to elaborate on that? So, okay, I talked to my local dentist and asked a few questions and asked about her work life. I have no experience, so would it be relevant to include any reflections I've made? Yeah, of course. Look, any reflections you have, anything is good, right? So I talked about, what did I talk about that was completely irrelevant to medicine or even work experience? Um, I remember saying something about football team. So I was part of a football team. And we had a captaincy, and I was captain of a football team. And it's completely irrelevant to medicine. So you have to understand, right? When talking about your personal and reflections, it's not just reflections of medically related things. It's reflections of your character and your attributes, which will make you an effective medic, which will make you an effective doctor. Things like communication. Communication isn't only shown in the GP room or in the GP. It's shown in your day-to-day life interactions with people and other things, if that makes sense. So I talked to my local dentist and asked a few questions and asked about her work life. I have no experience, so would it be relevant to include any reflections I made? Yeah. So what you can do is say, how I would word it is, on conversation or after a dialogue with my local dentist, I understood the difficulties of a dentist's life, or ask her questions and ask her different things which you can talk about and reflect how you have demonstrated those abilities or characteristics to be effective in it, or how you gave you a more holistic, that's another buzzword, holistic understanding of the career, holistic understanding of being a medical professional or being a dentist, if that makes sense. So yeah, me personally, I barely had any work experience. I think I only had a day, less than that, maybe half a day, because I kind of gave up on it. But you can twist anything into making it a reflection and a reflection of your character, if that makes sense. So yeah. Now, this is another sample from my first statement. I'm going to go through it. I'm going to read it for you guys, and then we can have a conversation about it. So in the A&E of the Royal London Hospital, I observed the diversity of patients that came in and the problems they faced. I was impressed with the abilities of the doctors to adapt to a plethora of challenging situations and the ease in which they created a rapport with every patient. The ability to build trusting relationships with those who are vulnerable was developed within me from an early age while supporting my uncle after he lost his sight and became paralyzed from the waist down. Now, do you see how I've given the context, so which is Royal London Hospital? I'm now seeing what I saw, which is the diverse patients that came in and the doctors building rapport with patients. And I'm now seeing how I have shown the same thing. Do you see how effective that is? I'm telling them my work experience, and now what I have personally done, or what personally makes me applicable, or kind of what's the word, on wavelengths with being a medical professional, having the same characteristics as them. So while supporting my uncle, he developed patience in me, developed empathy in me, seeing someone who's vulnerable, physically and emotionally, and that built within me a level of empathy which can then be applied to a doctor and a medical professional when dealing with patients, etc. So you want to be applying characteristics, showing that you have those characteristics that you've witnessed in the work, in the professional work field and things like that, if that makes sense. Do you guys have any questions about that? I had a point, and I'm just trying to remember what that point was. Important point. If not, feel free to ask any questions. Hiba, Mime, do you guys have anything to add to that, or any like examples that you would have said? That's what I mean about using this as a learning experience. Use this personal statement, the application process, for you to develop on your ability to articulate, be comprehensive, and real critical on certain things and details. So Bilal asked, so it's alright to have a mix of work experience and volunteering and stuff like that if it flows. I thought that you should keep one paragraph for work experience and one for extracurricular, one for volunteering, etc. Yeah, no, for sure. I wouldn't go with that format. The way I see it is try to be free flowing as much as you can. Don't have it properly structured. When I had my structure, it was just a general thing. It wasn't a structure as such. Like I'm gonna have this point, this point, this point. It was so flowing of my experiences, and it kind of went on from one point to another, very nicely and smoothly. And the work experience, volunteering, and all of that stuff, that's all one thing. They're not different things. You're reflecting on everything that you're doing, if that makes sense. Even you could even talk about your A levels and use that as an experience. So for example, you can see that studying medicine and the content of medicine is very overwhelming due to the sheer content and the overwhelming amount of content that you're digesting throughout the 6 years or 5 years of medicine. However, studying 3 or 4 A levels and managing my time and being organized effectively, whilst making sure that my leisure time is there as well, has allowed me to tackle the overwhelming nature of academia. Hence why I can deal with the overwhelming nature of medicine, if that makes sense. So it's things like that. You could use something that's completely not medically related, but show that it's developed you, it's given you characteristics which has made you viable for medicine or being a medical student. Does that make sense? Does that answer your question? As long as it literally, as long as it flows and you're reflecting and showing that it's your character, it's you have the abilities or the characteristics which they want. Things like resilience, empathy, patience. These are the buzzwords you need to be chucking in everywhere. Holistic understanding of medicine, patient care, patient-centered care. Another thing is having a realistic understanding of medicine, right? What a lot of people do in their personal statement is they talk about medicine as it's some dream job. It's amazing. We're going to help the community. And I think Mariam and Hiba talked about this before. It's fine if you love medicine, if you love the nature of medicine, you will enjoy it, and that's fine. But also make sure that you're giving them the understanding that you have a realistic view of what it means to be a medical student or what it means to be a doctor. So talking about maybe somewhere in your personal statement that I understand that medicine is something that's difficult and overwhelming. However, to adjust my abilities to suit this sort of studies or course, I have studied this, I have done that, I have taken on these kind of workloads, and it's adjusted me to make sure that I can be viable for it. With a limited word count, how do you select experiences to include? A very good point. A very good point. A question, sorry, because I had quite a few. When I first made my draft, I had to take out about 3 experiences out of it. Do you go with experience with best? Yes. Simply put, literally, whichever one gives you the best reflection and gives you the most snappiest kind of understandings of your character and what makes you a good prospective medical student, I would go with those ones. Yes, the ones you can talk about reflections the most. So things like me looking at the Royal Hospital, the golden minute, showed me why empathy is important, building rapport with the patient is important, and hence why why I chose that, because it just gave me the opportunity to talk about why I have the characteristics developed within me because I dealt with my uncle who's disabled, who's visually impaired and is in a wheelchair. Dealing with him has made me understand that the patients. Okay, that's another thing. Another side point is what I mentioned, especially in modern times where this is a lot more rife about mental health, is medicine isn't just a physical healing. It isn't just, okay, you have this issue, this problem, I'm going to prescribe you this medicine, I'll give you this treatment, I'll give you this surgery to help you, right? Medicine is a holistic patient care. And what you'll see is, and what I saw was I did a placement in dermatology clinic where a lot of patients come in with insecurities, come with mental pressure, come with overwhelming loads of pressure and insecurities because of certain medical things. So you're not only treating them physically. This is what my first statement is. Through my work experience, I understood. I can read that actually. What did I write? I'll read that more specifically so you guys get a good idea. I said, my time with a dermatologist opened my eyes to how health can negative social impact. My time can have negative social impacts. An example being psoriasis, which was common. It astounded me how the small flaw of rapid replacement of cells in the deepest layer of the skin before being fully mature could result in long-term physical and insecurities stemming from the red flaky patches these patients often have. Thus, the aid of a doctor is not restricted to helping a patient physically, but also their psychological challenges. Do you see? So it's giving them, I feel like that gave me an edge because a lot of tackle medicine or talks about medicine in a more physical sense. It's surgeries and medication and things like that. But there is a mental aspect to it. There is a psychological aspect to it. Patients are coming in physically hurt, but they're also very emotionally overwhelmed. And as a patient, as a doctor, as a medical professional, as a GP or wherever you are, you're going to speaking to patients in a very empathetic manner. It's these buzzwords, empathetic manner, in a very calming manner, in a very you're going to be consoling them and building that rapport and relationship with them. So understanding those two aspects of it and maybe talking about that can give you that edge. Someone has asked, will universities take into consideration that work experience placements got cancelled? Yeah, 100%. End of the day, universities need students for their places. They're not, and I say this to a lot of people. A lot of people think that the whole application process is made to just like, we don't want you, you need to be super thingy or whatnot. Like they do want you, even when you go to interviews, right? They are the nicest people. It's not daunting at all. Interviewers are really and truly the nicest people you will meet. They're there to help you. They just want to have a sense of your character and how you are as a person to show that you're capable of being a medical professional. So yeah, given COVID and a lot of work experiences being restricted and cancelled in total, I think there will be a lot of lacks on that. However, regardless of that, the bulk of your first statement will have to be reflections. It doesn't have to be a work experience. It's what me and Hiba mentioned before. Your work experience isn't strictly medically related. Yeah, it's anything that you've done in your life, be it extracurricular, being with your community work. So one thing I mentioned actually is my summer school. So I run a summer school in the local mosque for 16, and it runs for 2 weeks over the summer. This is completely irrelevant to medicine. It's just some school we help for kids. They come in over the summer, they're a bit productive. We do sessions with them, creative sessions, sports, and things like that. And I talked about how managing these sessions and managing students from different various age groups, 7 to 16, taught me that having empathy towards people is very important. And having empathy towards people, not just kids, but also patients. And that's how I apply it medically. So I've gotten an experience which isn't medically related, but I've applied it to how it's important in medicine. So I built rapport with students who have come to me. Maybe they've had a fight, or maybe they're upset about something, be it at home or in class. And they'll come to me as a teacher, as a senior, and say, "Sir, I've got this. I know I'm feeling sad and upset." And you can't just be thinking with them. It's very straightforward with them. You have to build a rapport with them. You have to build a relationship with them. Sit them down, be empathetic towards them, understand, hear them out, and that taught me, and seeing a GP in practice taught me why that's so important. Having empathy is so important. And it's how I developed empathy within myself. Hence why I will make a good medical student. Do you see? It's about twisting any experience that you have and working it in your favor. And I did that in my personal statement. It was this, doing the summer school was completely not medically related. However, I showed why you can apply it to medicine. So even if you are lacking any sort of experience in the medical field, think about experiences that you have where you've where you've demonstrated things like resilience, empathy, care, patience, and things like that, and why that makes you a good medical student or prospective medical student. Does that make sense? It's not one-sided. They're not looking for people who are just, okay, I've done this GP, I've done this A&E and things like that. They don't care about that. They care about your reflections and what characteristics that you can demonstrate in your personal statement that will make you a good medical student. I hope that answers your question. Any more questions?